everyone in this group expressed that you were either very hesitant or extremely hesitant, but you all decided to get the vaccine. I want to know the moment when you said, you know what, that's it. Even though I'm hesitant, I'm going to get it. Marie from New York.
When I did the last focus group with you and you had the doctor from the CDC on, he explained it much better than Fauci or any of them ever did.
Gail from DC.
Lost friends and family, and people getting the vaccine were surviving it.
What was the moment, Shirley, that you decided I'm going to get the vaccine?
When my friend got sick and she told us, you don't want this on, we don't wish this on you.
Ulysses from Texas.
Had 3 family members pass away, a neighbor pass away, a friend of mine works in the ICU on the COVID floor, and she told me how bad it was.
Philip from New Jersey, what was the precise moment that you decided to get the vaccine?
The precise moment I decided to get the vaccine was after talking to some highly credible medical professionals that are family friends in New York and are first responders on the line every day, looking at what's coming in and out and what they're bagging and tagging.
Bagging and tagging, wow. You're the first group that I've sat down with who was equally as hesitant, but you made the plunge. I want to figure out what you learned so that I can teach others the same thing. Raphael, you're going to go first, and then Elizabeth.
Well, for me, I suffer from depression, and I miss having my group therapy. And one of the reasons why I wanted to get it is if enough people who became fully vaccinated got the shots, I could go back to group therapy. Also, the idea of getting some sense of normalcy back to my life, being able to go to a Dodger game, being able to travel. You need to have the vaccination to do it. And for me, beating my depression was more important than my fear of the vaccine.
And I'm just going to stop for one moment. I appreciate your candor. I really do.
Thank you.
I'm so glad that you're on this session, and I hope that people hear your words.
Yeah, because for me, it's interesting. Like I mentioned, it was important as time went on that I learned that there weren't any major effects that people were having from these vaccines. But honestly, rather than there being a moment that I learned something, it was more like as time went on, the balance of things that I wanted and that I wanted for my daughter, and I want to travel and I want to get back to normalcy. Those things sort of started to tip the scale. And my fears about getting vaccinated are honestly still there. And I have both doses, right? I'm still a little, I read articles and I think, oh goodness, is there going to be something they discover? It's still here. I don't feel 100%, but I just felt like in my decision making, the pros and cons shifted.
I want each of you to tell me who you trust most. Who do you trust most when you're looking for information on the COVID-19 vaccine? Victor from Michigan, I know who you don't trust. Who do you trust when it comes to information on the vaccine?
My doctor.
Why your doctor?
Because he is the one who knows all of my health issues, who knows all of the medications that I take. And he's really good about when new things come out, incorporating that, into what I have to do to stay healthy. I mean, I had to really quarantine hard for almost a year.
I'm with Victor. I trust my doctor. He's been my doctor for 35 years. He knows I'm diabetic. He knows all my medication I'm on, and he knows all about me, and he does, and he's a pretty good research doctor. I mean, he's my family doctor, but he does a lot of over and beyond what his practice does. I mean, he's a smart doctor.
Anderson, who do you trust most when it comes to COVID-19 vaccine and information on COVID?
Yeah, my medical professional, he knows me. He's well-researched, and he shoots it straight with me.
Lauren, who do you trust most?
I trust, believe it or not, my pharmacist. I think they're very, I mean, I've had the same pharmacist for over 10 years. I go to the local Walgreens. She has a lot of knowledge, a lot of information. I feel like I could have a conversation with her regarding medications for my family, for my children, vaccines. I completely trust her.
Gail, who do you trust most?
My pharmacist. My doctor prescribes everything, but the pharmacist is the one who will take the time to just let me know about the side effects. And I was so freaked out. I actually had 2 appointments, one for the 2-appointment one for Johnson & Johnson. And when I asked my pharmacist, okay, which one? Because the 2-shot one was going to be my pharmacist giving me the shot, who I trust and like. But I went with Johnson & Johnson, and so there you go.
Great.
I want you to give me a single sentence description of all those people who aren't vaccinated, of all those people who won't get vaccinated. Give me a sentence to describe what you think of them with you all being vaccinated. And Elizabeth, you can put your hand down because I'm going to ask everybody here. A sentence or 2, I'll let you go to 2 sentences about all those people who won't get vaccinated. Victor?
Perfectly within their rights, doesn't have anything to do with me.
Kim?
I think they'll come around.
Philip?
I guess it was Victor that just said that before. Has nothing to do with me because every single person that's on this Zoom right now was a skeptic. So I get it. If you're a skeptic, like the 18 or 19 of us that are on here right now, no problem, I get it. If you're a skeptic because you're following Trump, who did get the vaccine, and maybe you're too stupid to know that he did get the vaccine, that's a different story. Because Trump played it off as, oh, you shouldn't get the vaccine, but he got the vaccine.
Lauren?
You're on
Lauren, we
mute.
cannot hear you. Lauren, we can't hear you.
There you go.
That I'm thinking that they're gonna come around, because if they don't, we're not gonna get back to normal ever, because we need the herd immunity.
Every day.
What makes you think that they're going to come around, Lauren?
I came around because people are gonna want to do things that they're not gonna be able to do without the vaccine. I mean,
Yeah.
now even colleges are mandating that kids, to go to college. So eventually I think more and more places are gonna mandate that you need to have it.
Elizabeth, how do you feel about people who up to now have refused to get the vaccine?
I understand. I respectfully disagree. And I think you're a little selfish.
Because?
Because I think for me, I shifted my focus from myself to other people, to herd immunity, to a bigger picture outside of just this bubble. And that was when I decided to get the vaccine.
What does getting America back to being America look like? People say back to normal. But when and how will you know that America is back to normal again?
I'm not sure what that looks like at this point, because going back to, we don't know if we have to get a second shot, if and when, and we don't know about the long-term effects. So I'm not really sure how to answer that.
Lauren, when will you know that America's gone back to normal? What will it look like?
Everything is open, full capacity, no more social distancing. Businesses are just open and, just like we used to, and no more masks.
Yeah.
Philip, America getting back to America again. When will you know it, and what does it look like?
Well, I guess it will look like it if those that are telecommuting like I am, which is great, want to go back into an office and offices are filled up. I'm not. I guess, as Lauren said, which is one of the things I agree with her on, whereas we're not 6 feet apart anymore, or now in some cases it's 3 feet apart, and rooftop lounges in New York are open back up till 4 a.m. and Manhattan's vibrant, and I guess that's what you can call normal. But it's never going to get back to normal, because as many in the medical community have said, and it's a warning, there's going to be another pandemic. Let that be known. There's going to be another pandemic. So
I hope not.
Elizabeth, back to normal. What does it look like, and what does it feel like?
It looks like when I can take my at-risk daughter on a vacation, on a trip to the playground down the street without having to think about what she's touching, the last time that I washed her hands, and making sure that she doesn't put her fingers in her mouth.
Yeah. Harry, back to normal. What does it look like and what does it feel like?
When I'm not terrified to stand in a room with 6 other people and breathe. I have no idea when that'll be, but that's it.